Bismillahirrahmanirrahim. Today I am going to talk about appendicular abscess. Appendix can become very notorious once it gets perforated, and it can cause generalized peritonitis, or it can cause localized abscess formation. Now, this was a young male patient who was running fever, pyrexial, and had a tender mass in the right iliac fossa. So a CT scan of the abdomen was done, and you can see over here, this is the CT scan of the abdomen, and on the right side you can see a mass over here in the right lower abdomen, quite a substantial mass. These are the loops of the small gut, and that's the ascending colon. You can see it over here. All over the place, and it's extending into this is the psoas muscle, so it's going towards the psoas muscle, extending quite a substantial mass. So this was on the longitudinal section, and when you see the transverse section of the abdomen, you can appreciate the mass becomes evident over here. That's the mass over here in the right iliac fossa. It's more clear. This is the CT scan 64 slice, and it's very clear over here. This patient was operated, and I'll try to show you the operative pictures later on. And the conclusions of this CT finding was there is evidence of hypodense mass in the right iliac fossa. The mass is involving the right iliopsoas muscle in the pelvis, with also superior extension to involve the right psoas muscle up to the level of L3. The mass is involving the posterior and right lateral abdominal wall just above the level of iliac crest. The appendix is not visualized separate from the mass. The mass is focally abutting the cecum and terminal ileum segment with contiguous thickening of its wall. Mass shows multiple loculi and separations within it. Mass measures 11.5 by 10 centimeters in anteroposterior and transverse diameter. The craniocaudal extent of the mass is 11.5 centimeters. Findings are most probably due to perforated appendix with surrounding abscess formation in the right iliac fossa, involving the iliopsoas muscle and the contiguous bowel loops. There is a presence of a simple cyst in the mid-cortex of the left kidney, measuring 2 by 2 centimeters. This was an incidental finding, and no lesion seen in the liver, gallbladder, spleen, pancreas, adrenals, right kidney, urinary bladder, seminal vesicles, and prostate. There was no evidence of abdominal or pelvic lymphadenopathy. This patient was operated, and a very large abscess cavity, which was retrocaecal, was drained. So this is a